Here we are. We've got Shannon Burford with us. Thanks for joining us for the podcast again, Shannon. How are you today?
I'm awesome, very
Excellent.
well,
All
and
right.
having a great morning. How about yourself?
Very good. Very good. We're on our way, and you're hearing me really well on YouTube at your end, so
I
that's
did hear it. Yeah.
promising. And what we want to cover today, Shannon, is probiotics and the effects they can have on autoimmune conditions. In particular, we're going to
Mm.
look at a paper on probiotic in the treatment of celiac disease,
Hmm.
and we'll probably refer to some previous papers, and we'll look at Bifidobacterium and its anti-inflammatory effects, because I often get that in clinic a lot where we see low Bifidobacterium. And this is one of the probiotics that's used in this particular paper we're looking at and some of the other papers. And
Hmm.
we'll talk about probiotics in general and in treating certain conditions, and maybe mention a couple of our favorites. I've also got a surprise for Shannon today. We're going to do a bit of a news look at the news of examine.com's recent studies, but there's several ones there that are relevant to what we're talking about today. So hopefully I won't get Shannon too off guard there, and we can talk about a few things there. In particular, there's one main probiotic that's really well studied that's used to treat allergy in a particular
Mm.
paper, and I think we could go on a whole podcast on that probiotic alone. So I think Shannon's probably got
Mm.
an idea which one I'm talking about, but that's coming up later on. So let's get stuck into it, Shannon. What about this research paper on probiotics in the treatment of celiac disease? What did you think about that?
Excellent. So it was about adjunctive. What was the title? Adjunctive treatment of celiac disease.
Yep.
It was a 2025 from Brazil, and it just keeps more and more evidence like this keeps supporting the fact that probiotics help in multiple areas of all disease, really. And this is celiac disease. But they had, I think, if I remember rightly, it was 85 participants, adults, and they double-blind placebo. They split into two groups, and they had bifido, as you say, and lactobacillus rhamnosus too. And the summary was it reduced inflammation, improved results and symptoms for the celiac patients. So summary is probiotics are great for celiac. And then I think the title of the podcast is Can They Cure Celiac or Probiotics, Celiac Disease? Well, a bit clickbaity, but potentially it can. And this paper is showing supportive evidence for those probiotics.
Yes,
Yeah.
and the paper concluded that probiotics continue to contribute. Right here, I think the little hand showing up, I think, on the screen there. Symptom improvement, enhanced quality of life in celiac disease patients. So it's an adjunct therapy, Shannon, and
Mm.
it's adjunct in the sense that the other therapy that's used for celiac disease, of course, is going gluten free. So that's what's going on here. And they've used Lactobacillus rhamnosus species, and the strain they've got there is CCT7863, and the Bifidobacterium lactis is the bifido they're using there, and that's CCT7858. So I mentioned the strains there, Shannon. Do you find that being strain specific is important in clinical practice? And do you go strain specific in most cases? And just what are your thoughts on looking at that strain, that CCT 7863, for when you're using probiotics in clinical practice?
Yeah, for sure. Most definitely. And so when we get patients, like you're watching this and you may be celiac or similar autoimmune conditions and you want results and you go to the practitioner, that's what you're going there for. So we need to be very specific with those strains to get a appropriate response in you, positive appropriate response. So if you're taking something like fermented food or yogurt, the label might say lactobacillus rhamnosus on the yogurt, but it's not a specific tested species and variety like this. I'll explain it like a genus is people, and then there's species. Like Lactobacillus is the genus, and Rhamnosus is the species, and then the code on the end is very specific. It might be a geography teacher who teaches a special type, and this probiotics is having that specific effect, whether it's on immunity or anti-inflammatory. So to answer your question, most definitely, if a patient comes, we want to use those specific strains, get a result, then we go back over time to a food-based probiotic, which is most definitely beneficial, but it's more of a wild strain. It's like a garden and you're just throwing things in there and hoping they'll stick. They are probably beneficial, but not as specific as the effect of a specific strain that you can prescribe
Yeah.
and know confidently that you're going to get a positive result.
That's right. If we do use the specific strain as what's used in clinical trials, we know we should get that result. Now,
Mm,
obviously, using probiotic in isolation is really never what we do anyway. We often prescribing prebiotics for helping that probiotic
mm,
flourish. There might be uh, something like SB, so Saccharomyces boulardii,
mm,
being used at the same time as well, depending on the condition. And
mm-hmm.
generally, anything that's going to increase mucosal health in the gut, we're going to be using in addition to that probiotic. So it's a synergistic effect, and multiple modalities are at play to try and get the desired outcome. Also, I just want to do a quick shout out. I think these are from Austral Herbs. I opened up a fresh packet of peppermint tea today, and Shannon, it just was amazing. It just blew my mind. So I'm going to try and promote herbal teas a lot more because they're so therapeutic.
Mm,
If you have them for 15 minutes, the leaf and flower, or steep the root for 20 minutes. So this is licorice, peppermint, and a bit of sam sam sambucus in there. So
beautiful.
elderflower, and yeah, like I said, fresh peppermint and green tea. Green tea there. So
Mm,
delicious stuff. But back to the podcast and probiotics. Yeah, so this is not the only paper we've seen in relation to probiotics treating celiac disease. In fact, autoimmune disease in general, and a lot of work's been done with probiotics and inflammatory bowel disease too. So Shannon's looked at a couple of other research papers there. There was one particularly on Bifidobacterium in children, so another Bifido strain, and again some positive outcomes. And some of these papers, the strength of them might not be there, Shannon, but we know in clinical practice we see a lot of benefits with something like Bifidobacterium, and we'll talk a little bit later about that. But we, like, again, going back to what I previously said about, we're not using probiotics in isolation ever as well. We're using
mm,
them in conjunction with other things like prebiotics, um, mucosal barrier repairing type herbs like slippery elm, licorice, this sort of thing as well, which really enhances their effect. And I think there's positive outcomes in this particular paper, and there I think when we look at something like this, I think we can expect even better outcomes on top of what's been shown in the research, just purely with all the other things we would be doing to improve mucosal health. Do you agree with that?
most definitely. I actually wouldn't, in say first consult or even uh, second, third, I often wouldn't give probiotics. So say someone comes with a autoimmune condition or celiac, it's just that you've got so many tools to prescribe, like you say, herbs, like you're drinking those herbs with rich in polyphenols, which are going to help probiotics. And there's nutrient deficiencies, toxicity, detox channels, diet is absolutely foundational. So there's so much to do and so many potential things that can be done. So just to give probiotics, it's not going to have as an effect as herbs or nutrients, and I've got to work out what are the keys. And as I said, the diet. So if someone comes, usually there's going to be at least three things that you can pick out as keys that can be changed in the diet, and that's going to have a more profound effect on the gut health. And we're talking about celiac today. It surprised me with the study that they talk about removing it for a period of time. But if you're celiac, you should be eating zero gluten forever.
Yes.
There's no point in maintaining that inflammation. So setting those real important foundations,
Recording in
this
progress.
this thing is causing aggravation for your gut, and they might even not know that it has gluten in it, and just picking that out and saying you shouldn't eat that in 4 weeks, that's going to have a profound effect. Yeah. So, and then eventually getting to those probiotics, maybe doing a microbiome stool test and identifying which specific strains are going to be more beneficial, and maybe doing cleaning out opportunistic bacteria or parasites. But yeah, I often wouldn't give probiotics immediately, as there's so many other things you could do first.
Yeah,
Yeah. How about you, Brad?
Yeah, no, that's excellent advice. And yeah, there's a lot you do initially. And like you said, there might be antimicrobial treatments. I mean, we're looking to try and heal and repair a lot sooner in the process, as opposed to the traditional naturopathic way of weed, seed, and feed. Um, but that being said, as a caveat, I know I often will add probiotics in a bit earlier if I know that those specific strains, like we're talking about specific strains before, are going to be beneficial in knocking out a pathogen, for example. And again, even something like Bifido, which we'll talk a little more a bit about, Bifidobacterium has been shown to have such positive effects on the gut that sometimes I will bring that in a bit earlier before I do strong antimicrobial treatment as well. So it all all depends on the treatment. This is where it's so individualized. You've got to really take it in. Like, we're often looking at microbiome analysis or doing microbiome analysis on metagenomic sequencing studies and gut function markers and so forth. So that will dictate a lot of what we do. But also, more importantly, is looking at the patient. What can they tolerate? What's good for them? And initial probiotic treatment might be the worst thing to do initially. So, but that being said, too, we are getting better at understanding the negative effects that probiotics can have and their safety profiles, which again in the research we've been looking at, in particular this one with celiac, the treatment of celiac disease, there was a great safety profile. So that enables us to utilize different strains. Again, you want to be strain specific if you're being cautious and you want to be safe. But yeah, like you said, in most cases, you're not going to go in with probiotics initially, and that would come in as a later stage treatment. And even when I do use probiotics earlier on, like I said, that some of them can help combat a pathogen, I will be using them quite differently to when I'm doing a complete healing phase of the patient. So they might come in as adjunct therapy to herbal medicines, and that might be like one capsule daily, and it might even be a safeguard against strong antimicrobials. So, for example, berberine will knock out Bifidobacterium. So I might be having one capsule in there as part of an antimicrobial treatment just to keep the bifido going through the system. And even though that berberine might be wiping that out, as well as the pathogen, that's why you got it there in the first place. And then later on, when I'm doing a more of a healing phase, and they've got their glutamine, dosing that up to potentially 15 grams a day, in addition to a gut healing powder, that might be where I have 2 or 3 probiotics going. And then that's higher dose probiotics. And then what you're doing is you're phasing out the probiotic treatments, bringing in the fermented foods and the polyphenol rich diet, or specific diets, catering to what you might find in a microbiome analysis and so forth. So there's a lot going on, but probiotics play a significant role throughout the whole process. Even if you're not using them, you're considering them, and you're considering the gut flora as part of the healing phase. And in this day and age, where we know that the gut flora plays a specific role in mood and behavior in conditions like Alzheimer's disease and Parkinson's
everything.
and so forth. So you are always considering probiotics, or at least the gut flora of the individual you're treating. So that's important to keep in mind as well.
I can't help but think, always I'm thinking about the patient and the cost involved, because probiotics, I got some for myself just the other day. It was like a bioceuticals one, if I remember rightly. And it was over $1 per capsule. I mean, it is a high strength and strain specific, but when a patient comes and if the patient can afford it, definitely it's going to be beneficial to take some probiotics. And there's going to be, as you say, they're taking the berberine, taking probiotics. There's that time through the transit of the bowel that it's going to be anti-inflammatory and have a beneficial effect. Even if it's getting killed a couple of hours later, there's that moment of having anti-inflammatory effect and positive effects, but if they can afford it. But then there's those patients that are really struggling, and then there's this for, it's very high quality ingredients, but there's this for $50, this for $100, this for $50. And if they're going to have to struggle financially, I always think, well, how can we do that? Or can we put the polyphenol rich food in? Can I get you doing that first, and then we'll do that? But especially through those after the microbiome test and doing a removal of a opportunistic bacteria, parasite, or yeast or something, and you got to prioritize. I say, let's just save that for 2 to 4 weeks, and we'll bring that back in later. But it goes back to, as we always repeat, and you've said multiple times earlier, it's individual cases, and we're always making it personalized. And that's our job, is to really try and help that patient in front of us to make it stress free as much as possible and beneficial for the patient's health.
Yeah, and you touch on a great point there, because I'm working on a video at the moment, the difference between functional medicine and naturopathic medicine. And people listening to this might start freaking out and going, oh, I've got to get a microbiome test. I have to spend all that money. Like you mentioned, some of these probiotics can cost a fortune. And you don't have to. You don't have to get the microbiome analysis. A proper trained naturopath. Now,
I like that.
I don't want to have a dig at our own profession, but I will, because it's becoming very dominated by functional medicine approaches. Now, there's nothing wrong with functional medicine approaches, but they are expensive. Now, you could go to a functional medicine practitioner and you could be up for over $1,000 worth of tests before you even start.
Just testing.
Just testing alone. They want you to get the DNA testing. They want you to get
some practitioners do that.
Test. Yeah, they want you to.
They say I won't see you unless you do these XYZ
and we're
tests.
seeing it in the integrative medicine docs doing it as well. Doctors practicing in integrative medicine here in Australia, at least. The first part of you seeing them is setting you up for thousands of dollars worth of functional testing. Now,
and that cuts a whole heap of people out. The people most vulnerable that need it, need the care.
And like what you should be able to do is see a naturopath. You should have a really detailed case study taken, and as we often do, and we've talked about in the past, we see a lot of things going on with that individual, with that person. If they've got poor elimination, if their constitution is indicating that they're running cold, and there might be issues with thyroid. If they're a inflamed person, and they're, I'm thinking of men in this picture, they've got their liver's not, the liver's taken a battering. There's so many things you can work on that's going to improve their health and improve their ability to heal their gut and improve gut function. So there's a lot you can do without the functional testing. And often, if you go down the path without the functional testing, you'll be taking care of a lot of other things that get missed by testing. Because testing's great. It's a great tool to use, but it is only a tool. You've got to really connect with your patient and that individual and fix a lot of things. And sometimes, I'm sure you've had many patients like this. They're jumping to practitioner to practitioner. They're getting all these tests done.
Yeah.
And they're just not sticking to their treatment plan, and they're not dealing with the deep-seated issues.
The real issue.
Yeah, working internally. They've got stuff that they're just burying deep inside.
Looking for the magic test that will
and they're looking for the magic test that's going to solve it, the magic pill that's going to solve it. And really, they've got to work on a lot of deeper-seated issues and bring that out and work through them. And they can be painful and confronting, but you certainly don't need to spend thousands and thousands of dollars to do that. And again, that's where naturopathic medicine can shine and highlight those areas of that are needed to be worked on. And then, as far as treatments go, you don't need to spend the money on the expensive probiotics. Now, in some cases, people just struggle changing diet and lifestyle. That's a reality, and they'd rather go for, more supplements in the mix. But even those individuals, I am putting a lot of pressure on them and getting them to be accountable for making significant changes in their diet and lifestyle, even if we can only budge them bit by bit. Even if it's just little incremental permanent changes, walking more, being out in nature more, little shifts in the diet that can make a big difference over the long term. So that's great, Shannon. I'm glad you touched on that, because I'm working on a video that's going to be coming up very soon that talks about those differences of functional medicine and naturopathic medicine. And it's important to note too that functional medicine is a certification that many modalities like a chiropractor or a nutritionist or a dietitian or someone can have. However, naturopathic medicine is a whole traditional medical system that's really large in scope, and functional medicine can fit within the framework of naturopathic medicine, but it's not the other way around. So I think that's an important or distinct feature of naturopathic medicine. It's and I often think of when we're doing detailed treatment plans or word maps that you'll utilize to explain what's going on for a patient. I often look at the example of what they do in functional medicine, and very precision based on a lot of functional testing. And you might have a dozen things with lines connected to this and that, and trying to weed out the root cause, and it can be very effective. But I often think of naturopathic medicine, if we apply, when we're using the same framework, instead of those dozen things going on, relying on functional testing, you'd expand on that. That would be one element of the picture with naturopathic medicine, and then you'd have another group of a dozen things here talking about psychosocial elements and spirituality and connection to the environment, and you'll have environmental toxins and other things in greater depth here. And there'll be so many more things. You'll have traditional constitutional things, whether it's coming from Ayurvedic medicine, Chinese medicine, or traditional Western herbal medicine, and even traditional naturopathic ways of looking at that. So you tend to have this bigger landscape to draw from when you're looking at naturopathic medicine, as opposed to this functional medicine picture. Both have very valuable traits, and both are important, and that's why we adopt their functional medicine model, or take that within the scope of naturopathic medicine. But the founder of functional medicine, I've forgotten, his name's escaped me now. He came out of naturopathic, or using the naturopathic models and naturopathic medicine, and brought a lot of that within the functional medicine framework. So I think the origins of functional medicine, you could say, stem a lot from naturopathic medicine, but they don't capture naturopathic medicine as a whole. Obviously, you can see I've been doing some work on this. I've nearly hijacked the whole podcast on that.
That's great, and that's the deeper, really valuable knowledge there, and that's the more important. And you can see the passion come out. I think we're really lucky. We both studied in Melbourne at Southern School with some of those pioneers, and I really worry that it's that traditional medicine and thinking holistically for the patient is becoming so much less common. I went to a conference recently, and everything was very. I mean, there's benefit of being scientifically based, but there was a large component of these young practitioners, not bagging them, it's just different framework, but they were looking for the protocol and they were looking for the pill. And that's the way the company is. So it's becoming more pharmaceutical driven, where it's natural, but it's in a pill. And take this pill for this. Oh, you've got bloating, well, you take this. And you've mentioned a couple of times berberine. It's becoming a bit of a problem now, where on the internet and everywhere, everyone's talking about, well, if you've got blood sugar issues, you've got this issue, just take the berberine. And it's not designed for that. But unfortunately, practitioners are getting told that it's complicated, but we can't go into that model of a pill for a problem. And Brad and I studied together, and I'm really happy we studied at that college with those really old traditional naturopaths, and they would tell you stories and how the beautiful herb has energies and temperatures, and you shouldn't use it in this case. And I feel really blessed that I managed to study under them. And we've got to carry it on.
We do. And you in this day and age of AI and disconnect, I think what the traditional systems do better than any functional testing or anything else is they taught you to develop and prioritize a connection with your patient. And this is being lost. And I see it in new naturopaths coming through. If they totally disregard the traditional stuff because it doesn't fit within the evidence-based paradigm, they're losing their ability to connect at a deeper level with their patient. And this is a problem. And in this fast-track society where people just want to get tests, test, don't guess, which is a mantra that drives me nuts, because everyone loves to say, "Oh, I like to test, not guess." What they're actually saying is, "Oh, I don't want to deal too much with my patient. I just want to deal with test results and turn over patients as quick as I can." And that's because that's what's really happening. If they're not taking a deeper dive into what the patient's story is, and the traditional methods do that so well. And even though they may not fit within the evidence-based paradigm, the way you can connect with patients through those traditional systems is unrivaled at this stage, I believe.
Yeah. Yeah, with the microbiome testing, I most definitely do use it. So I'm sure you would agree, we're not bagging functional medicine. It can be
Absolutely
really
not.
valuable,
Mhm.
but it's about case by case and isn't necessary. I often
Yeah.
do these days, especially with inflation and people struggling financially. I'll say, well, you've got two options with the patient. Well, let's go with, I'm quite confident with my experience and this path, we can go this path and we'll leave it a month to 6 weeks or a little bit longer and we'll see if you get results. And if you're getting results, then we're going in the right direction. But if we get to the point where you don't get results, then let's do the microbiome test then.
Mhm.
Or we do the microbiome test right away. And often patients will go, look, I trust what you're saying, we'll wait. I mean, unless they've got unlimited funds and they say, I just want to do everything straight away, then that's fine. And then it does happen. We'll do it, and I've been surprised sometimes when the results come back, and I was like, "Oh, I thought it was an opportunistic bacteria, but there's two parasites there. No wonder we just get to this brick wall.
Mhm.
Okay, well we're going to change it slightly, and then boom, we get the results
Yep.
exactly what we need. Yeah, so that's what I do.
Yeah, pros and cons to both,
Mm.
and it's a case by case, and it's the functional tests are tools, part of the toolkit.
Mm.
However, the scope of naturopathic medicine and traditional medicines is very broad, and there's a lot we can use
Mm, mm.
as part of our toolbox. I just want to touch on going back to our paper, the celiac and
Back to the
probiotics.
probiotics.
Yep, I just want to
Yeah.
touch on the mechanism. So I'm going to attempt to get that diagram back up, Shannon, that I briefly discussed with you before as well. And let's see if we can get that going now.
Oh, with the immunity and the
Yeah, just to
gliadin
sort of talk
effect,
through. I want people to sort of
give you
understand
a
that
visual.
mechanism a lot better too. So hopefully everyone can see that okay. You can see that okay, Shannon, there.
Yes,
So what we have,
gliadin
yeah.
in
So
intestine.
yeah, yep. So there's a lot of things going on here. They talk because it's talking about T cells and B cells, immunity, the anti-transglutaminase antibodies, and all this sort of thing. It's more gliadin for a start. It's part of it's the component of gluten that causes the issues, and gliadins can be in other grains and everything too. So that's where we can sometimes see other grains being problematic too. But gliadin is a protein that comes down, and this is what it's actually doing. It's causing these activation of these immune cells, which in turn cause an inflammatory response, and we get this inflammatory response going on here, and then that disrupts the mucosal barrier, so the your gut wall basically, and that's when we're getting the damage of the villi for the absorption of the nutrients and whatnot, and then obviously leading to chronic intestinal inflammation. Now, what it does here, it goes off to the side here and talks about how it disrupts the microbiota in addition to this inflammatory process here that's going on. That most people are aware that you have gluten, you get inflamed gut and the damage to the gut, and that's the problem. So we take gluten out of the picture. But what we often see here too is what it's showing here is that gliadin is causing a disruption in bacteria. So it acts as a substrate for some bacteria, and then we get this overgrowth of bacteria that we don't want an overgrowth of, and then we get this dysbiotic picture, so this imbalance in microbes going on here. So this in turn, this dysbiosis then contributes to the inflammatory response here. So you get this
Mm.
inflammatory triangle, and also the disruption of the intestinal mucosal barrier down at this level of the inflammatory response that's come from the initial contact of gliadin also feeds into the dysbiosis. So you get this nasty inflammatory cycle going on here.
Mm-hmm.
And what probiotics can do they can come in and totally disrupt this part here all the way down to this dysbiotic part and break this cycle of inflammation that's going on here. So that's what we're seeing the probiotics do. And we're looking at particular strains. There's a rhamnosus strain in the study, and a Bifidobacterium, and we've looked at, there's other Bifidobacterium and other studies, like this study here, for example, the effect of Bifidobacterium breve on the intestinal microbiota of celiac children in a gluten-free diet. This is a pilot study. There was another meta-analysis, and when you look into the literature, there's quite a lot of work on this that's been done, and this is kind of the mechanisms at play that probiotics can work on. And even within this inflammatory process, T cells and B cell activation, probiotics can disrupt this part of the inflammatory process as well. And we're getting more and more knowledge on that. And of course, mechanistic data is one thing, but we want to see research outcomes. And then going back to our original study here, we're definitely seeing that in this study here. And I'll just try and highlight some of the positive results. The overall conclusion suggests that probiotics contribute to symptom improvement and enhanced quality of life. And if we go all the way down, if I can remember this study right, in the discussion here, they say probiotic treatment showed significant improvement in gastrointestinal symptoms, including abdominal distension. So that horrible distension you get, that bloating you get when you've got the inflamed gut, flatulence, and obviously nasty flatulence you don't want, diarrhea, and constipation. So a lot of good outcomes here in this study was shown. And additionally, they see an enhancement of the quality of life, which you would expect. If you've got these horrible things going on, distension, which can be quite painful, abdominal distension, especially when we're talking about celiac disease, that we often, people have trouble bloating, but in celiac disease, it can be quite painful. And they talk about they confirm the safety of the blend here too. So some really good findings there, Shannon. And I want to talk to your experience on this in regards to your using probiotics for autoimmune disease and celiac disease, but also I've mentioned in the notes prior, Bifidobacterium is an anti-inflammatory, or just using Bifido in general to move the bowels and this sort of thing. That's kind of where I see it, at that sort of the large intestine doing a lot of work. Do you want to talk a bit more about that?
Just about in autoimmunity. So I see a lot of patients with autoimmunity, fatigue. Obviously, celiac is an autoimmune condition. But you were saying earlier with that diagram about dysbiosis and inflammation. Yeah, that's apparent in almost all disease, but especially with autoimmunity. And I often give patients, I'm pretty sure it's on my webpage, autoimmune diet. And it's really paramount. The foundation for overcoming autoimmunity is through the gut. And I would use those probiotics to reduce inflammation. So your question was, do I use those in autoimmunity?
Yeah, well, I've mentioned Bifidobacterium as well. It's probably, I'm being a bit specific because it's come up for me a lot. It's been beneficial in combating pathogens when I've been treating a lot of, based on microbiome analysis and so forth, when pathogens or specific nasty bacteria or parasites come up. And I often see, what I'm seeing a lot of in clinical practice, in addition to treating these pathogens too, is low Bifido and low lactobacillus. And I often add Bifido into the equation because it can combat those pathogens and potentially help against parasites. Helps move the large bowel too. So if we're seeing
Oh, you mean for constipation?
yeah, for constipation
Okay.
as well, but also, like I said, in treating against, it helps outcompete other opportunistic and pathogenic bacteria.
It's definitely safe one.
It's very safe. It also has it promotes it has an anti-inflammatory effect as well. I find that by adding Bifidobacterium to the equation and in the treatment for most of my probiotic treatments that come in later on when we're just working on gut healing will have significant Bifidobacterium component to them, and because of its anti-inflammatory benefits too, and we see the enhancement or growth of other beneficial bacteria by bringing that in. And of course, if there's any stagnation in the bowel, Bifido will help with that as well. I'm getting a bit specific with the Bifido here, and you may not have looked into that as much, but I do find a lot of the research on whether it's celiac or inflammatory bowel disease, they are using a lot of different strains of Bifidobacterium or even different species. So, and this is one where obviously you want to use a good quality probiotic. One I use a lot of is Multigen from Bioconcepts. Is a very good probiotic. Obviously, it's a practitioner only, so you need to go through your practitioner for that. But there are other ones out there that are very good too. And that particular one I find has a lot of positive effects on the skin when I use it as
really
well.
good blends and brands around with probiotics.
There are. So do you have on that note, do you have a specific go-to probiotic or
I
ones
don't
that
have
you'd
a
like to throw in the mix?
go-to, but I often use Bioceuticals. It's a classic. It's made in the US. It's the Ultraflora 500, and gastroenterologists use it. It's just a really mega multi-strain one.
Yeah, it's quite a large one.
Yeah, almost all I would say have Bifido in them that I use. There'll be multi-strain predominantly. I can't think I use one without Bifido, just because you can't overdose. You can have as many as in a microbiome test as well. It'll show that no matter how high it is, it's not damaging. Whereas lactobacillus has more of a window, and can be problem causing if you have too much. So yeah.
Okay, great. All right. So as promised, I did have a surprise up our sleeve. As big a surprise for Shannon as it is for everyone else. That was every week I get studies come to me sent through examine.com, and they tailor the studies they send to me. I can pick what I like to look at, and they give me a selection. So I'll just get that back up on the screen for us again. And
was that the one with the graph that you just showed?
Yeah, so I'll just share that. No, that was a particular research paper. This is a few papers I wanted to discuss in regards to. Let me get that back up and that back up. Okay, so we've got that up here. So they send me this every week, and this is going to be sort of the news topic of the week, hopefully, if I get the regular podcasting going. So in the gut health study, there's heaps of really good ones here, but we'll just cover a few studies at the moment. We'll go to the gut health section, and
probiotics may improve acute diarrhea and vomiting in children. Ooh, how about that?
This was meta-analysis of 19 randomized controlled trials, so 5,170 children. So it's a pretty big study. And I was really, when I came across this, I liked that it reduced diarrhea. We can see here it's reduced diarrhea. I'm just going to get a nice colored one here. So reduced diarrhea 7.8 days. So that's quite significant. Now, vomiting, when I saw this initially, I thought 0.2 days, that doesn't sound that significant. But then I thought, hang on, point two is about four. It's about 6 hours. So, so if you could stop vomiting for 6 hours in this particular case,
4 hours.
what's that? Sorry,
4 hours, 6 hours. My
um,
math's brain
24.
doesn't matter.
Point two is about 20%. Is that 1/5?
20%.
One
Yeah.
fifth of the day. Sorry, it's about yeah, well, between 4 and 6. Anyway, um, but great. So that was a great result there. They talk
Yeah, and
about
oh, sorry to interrupt you. Just with vomiting, it's quite dangerous in children, so you wouldn't want that to be going for multiple days. You want
yeah,
it as short as possible. You don't want any vomiting, but yeah, I
yeah,
get what you mean.
and look, they received up to 3 times per day. So it may not be the most practical intervention in that regards,
Mm,
but again, we wouldn't ever use probiotics in isolation. So and maybe in this extreme um, case here, you it wouldn't necessarily be the first thing you go for. Plus, you're going to probably seek medical advice. But the fact that it had such a positive effect, I think, was very significant. It's such a big
mm.
meta-analysis. So definitely probiotics as an isolated treatment, it's quite possible to use them, and yeah, and a great result here in this particular case. So here's another one here too. This is one on allergic rhinitis. And I mentioned at the start of the podcast that we were talking about a significant probiotic that's very popular. This is it. This is the one that's
Mm.
been studied very well, Lactobacillus rhamnosus GG. And in this particular study, now examine.com go on to sort of give their take, and I sort of take it with a grain of salt because sometimes they're a bit all over the shop with their take on the study. There's mixed results. So study design and everything else will come into play. But there's so much studies out there. There's going to be poorer quality ones and everything too that'll skew the
Mm.
results. But if you I went to the actual study itself and to see what the outcome was, because they don't clearly tell us here in the summary. And it was and I thought you'd find this quite interesting too, Shannon. It shows a model of a probiotic strain. That's the kind of most recent name of Lactobacillus rhamnosus. I'm not going to even try and pronounce that at this stage.
Lactic acid
Um,
bacillus. Mm.
and so it's still the same one, and can traffic to the nose. So by chewing it, you'll get the benefits on the nasal passage,
Mm.
and they were using a slow release chewable tablet. Now I don't know if that's readily available in any commercial products. I haven't used that. I think there is. I think
Mm.
there is one that we can access, but I found that's very interesting because and it showed a lot of local benefits in the airways, including grass pollen induced nasal symptoms. And
Mm.
it's maybe not relevant to you. You're in the northern hemisphere at the moment, but here it's spring and it's very relevant. There's a lot of allergic rhinitis going around, and it's something I do suffer from time to time too. So I thought that was a really good finding of a very
Mm.
popular probiotic that people can get their hands on. The chewable one, I'm not too sure how common it is to get your hands on,
Mm.
but I thought that was a significant result there
Yeah, they have the
as well.
one for oral health too, and there's oral microbiome testing as well. But the oral health one is Biopractica Propertius, I think it's called.
Oh yes, yes,
Yeah,
yep, yep, yep. I
yeah.
know that.
There's I believe there's in the US nasal sprays as well. But anyway,
Yeah,
I'm
probiotic.
sorry, you've got my surprise. Was that it?
Um,
That's the surprise?
Yeah, yeah, they're the two studies I wanted to
Ah,
cover,
okay.
as well as one more here, because it's in the same. They put it under the autoimmune disease, but it's same for allergic rhinitis. There's another
Ah,
probiotic that's been shown to
in
be
53.
successful in the treatment of. This is a
53
formula.
bacterial strains,
Yeah. Um,
multi-strain to the
Yeah,
extreme.
now a caveat to this particular study, and they mention it here as well, that to increase confidence in the efficacy of this supplement, the results need to be replicated by another laboratory. So it's the same laboratory, it's their product and what have you. So you've got to
Mm.
take it with a grain of salt. But again, though, a positive outcome using probiotics and for just treating allergic rhinitis, and then
I
that
think,
initial one that for diarrhea. So I thought that was relevant in today's discussion because we're covering probiotics. So
see, can I ask, you see that SIN 53, SIN 53, SIN 4, did they compare the four strains to the 53 or did they use all of those three? Oh, it looks like they
followed by photo
placebo.
break. Yeah. Um,
They
It's a
use
good question. I haven't deep dived into this one,
oh,
mainly because I was just I haven't had time and I was
looking
going
at
through a lot of
allergic
stuff.
rhinitis. Okay, okay.
Yeah,
Sorry,
but
to throw that
I
in.
can I can also add this study to the show notes as well.
Oh, excellent.
The original study, I'll put it there. But like I said, that too, you've got to take it with a grain of salt because it's it needs to be
Mm,
reproduced. I would be more inclined. I'm basically just illustrating how probiotics can be used, and they're showing promising results in research. Obviously, a lot more research is needed, but the going back to the Lactobacillus rhamnosus GG study,
mm-hmm,
Lactobacillus rhamnosus GG is so beneficial for so many other things.
mm-hmm.
It'd be something that obviously we don't want to just people to go out there and use anything. And this is an educational podcast. It's not, we're not recommending people do what we advise here unless they see their health
Consult your
practitioner.
practitioner.
Yep, exactly. But it's so good for many other things like the Bacillus rhamnosus GG that it would be one of those ones that you could get away with using as a general probiotic for many health reasons. So
Mm-hmm.
there you go. So
Thank
hopefully I
you for
didn't catch
sharing
you.
that.
Hopefully I didn't catch you too off guard, but I thought they were relevant to what we were talking about today. And Shannon, I'd
Interesting
like to
stuff.
thank you for joining us on the podcast. It's always great having you. And if people want to catch up on some of your work and some videos that you're releasing at the moment, do you have a specific video I'd like to see, or you just want them directed to your YouTube channel? Where would you like people to
Yes, I'll
catch
be
up
a
with you?
collaborator on this one. It'll come in my channel and then just look at the latest ones I'm doing, but a lot about gut, a lot about energy. Yeah, but
Great.
have a look over there.
Fantastic. And if you want to catch more of me, let's go that way and maybe down there. We'll have another video posted there in due time, and you can see more of me in that video.